Today to have with me Melanie from Magnus Health, and I'll introduce Melanie in just a moment and share a little bit about who Magnus is and what they do. And of course, Melanie will be able to do that so much better than I. And before we jump into that, I'd just like to remind each of you what this series is all about. And we, long story short, at Joffe believe in doing everything possible to empower the entire community to respond to an emergency on a school campus. And so it's not enough for us to say, well, just a single school nurse on campus can respond, or just a single first aid team can respond, or frankly, just a single anything can respond. Our goal is that collectively, the entire community is able to respond and manage the medical emergency or the fire, earthquake, or lockdown, but also manage the psychological components of that emergency that go right alongside that. And beyond that, be able to respond to and manage the follow-up and the further care and the outcomes, and truly be able to cohesively support every single student, staff, faculty member, and even parent in their response for themselves to an emergency. And this year we started off this school safety series, and every Thursday at 10 a.m. Pacific, 1 p.m. Eastern, we're talking through various different topics related to school safety and emergency preparedness. And so we've enjoyed each of you that have been with us thus far. Today is our first day using this new technology for you, so we hope that you enjoy this new system that we're using to display the webinar for you today. And certainly we hope that we'll be able to get some feedback from you towards the end. That being said, along the way, one of the things that's been the most valuable for us in this series is your very questions, the questions and concerns that you raise and allow us to understand who you are and understand what challenges you're facing on campus and be able to get you as much information and make it bite-sized and customized for you and your campus. And so that's what we're all about. That being said, we'll ask that you share any questions that you have throughout the conversation today on the right-hand side of your screen. I'll talk with you a little bit more later on, but what I'd like to do now is transition over to Melanie. And as we transition to Melanie and to Magnus, I'll share with you that Magnus Health is a partner of ours, and they provide an incredible online student health and wellness database that allows our schools and, of course, a whole lot of other schools to be able to access and manage their student health and wellness data and information and ensure that they have the ability to relay that information to the right people at the right times. And there are three questions that Magnus often asks, and the first three, or rather the first one, is are you able to retrieve and share vital health information from any location on or off campus, but maintain the necessary privacy for your students? And so that's a question to think about and to be asking yourself throughout the conversation today, and then also to be asking if you're going to be thinking about Magnus or a similar program. The next question is, do all of your coaches and chaperones have immediate access to the information regarding life-threatening allergies, life-threatening other incidents that could occur, diabetics, things like that, current medications? Are they able to really manage and effectively understand what's going on with their students at any given time? And finally, in a pinch, can you reach a student's parent or guardian whenever you absolutely need to? And so as we go through the conversation today, and as Melanie shares a little bit more about what Magnus is, what it does, and all of the resources that are available to you within it, I'll ask that you continually ask yourself those questions based on how you're currently set up, as well as how you perhaps can be set up in the future, whether you choose to use Magnus or any other program. And so with that, I'll introduce Melanie, and welcome, Melanie.
Thank you, Chris. I am so glad that you have asked us to join your series. We are located in Raleigh, North Carolina. However, we have over 400 schools across the country. I have, in your California area, I think I'm up to like maybe 48, almost 50 schools in California alone. We do pretty much work with independent and private schools. And we recently, I should mention, acquired CareFlow, which was one of our direct competitors, and that acquisition was completed in July of this past summer. So for you all who have seen and heard a little bit about Magnus before, what you'll see is that our user interface is not going to change, but we're essentially taking the best of what CareFlow has to offer and a lot of robust practice management tools that they have, and we'll be bringing them over into Magnus so that we can just continue to develop and innovate our software to meet the needs of schools. So with that, what I'm going to do is, you can see my screen here. I will walk you through a demo. First, what I'm going to do is I'm going to mention the fact that we are both HIPAA and FERPA compliant. The vast majority, obviously, of independent and private schools, unless you receive funding from the federal government, you don't have to adhere by the guidelines of HIPAA and FERPA. However, the vast majority of schools do, because you are dealing with sensitive health information. And it's important that the right people have access to the limited amount of student information that they need at any given time, as well as Chris mentioned, the ability to contact parents in the event of an emergency, run compliance reports, and just make sure overall from a liability standpoint that your students are safe and your school is safe. So with that being said, what I'm going to do is I'm going to, like Chris said, please, by all means, use the right-hand side of your screen to ask any questions, and we will definitely address those. But I'm first going to show you the parent side of Magnus, and then I'll show you and move over to the school side. I will mention that we do have integrations with Whipple Hill, Blackbaud, Senior Systems, Veracross, Final Sight, Silver Point, and Power School. And to what that means to you all on the student information side is that with those integrations, you do have the ability to single sign on from your student information system right into Magnus, meaning that your parents wouldn't have to have two sets of usernames and logins, as well as some of those come with a nightly sync. So we're constantly updating, or you guys will constantly be updating Magnus with your latest, greatest roster information in regards to health emergency contacts and student information. So if there's more information that you'd like about that, you can simply go to Google and type in Magnus Health integrations. And there's a list of them there. And of course, I'll see if I can't show that before we get to wrap up today. So what I will do is again, log in as the parent. And the first thing that the parent is going to see is a brief video tutorial. Really speaks to the ease of use of the system and what the parent needs to do. If there's any additional questions, there's multiple ways to get in touch with our help desk that is dedicated just to parents only, as well as just giving us a call. We don't want any of those questions to be coming to the school. For those of you all who have multiple children within the same family attending the school, they're obviously going to show up as independently because they're going to have different graduating years, or what we refer to as trackers, and they're obviously going to have different help needs. So the parent's going to come in and they're going to click Complete Now. And here you can see this is just a sampling of the type of information that we can collect for your school. So as you're looking at this and I'm walking through it, just imagine the forms that your school collects. And we, during our implementation process, totally customize this page to your needs. While a lot of schools have similar needs, you guys can all operate and use different types of forms, so you do have the ability to completely customize that. The first thing I'm going to mention is this vital health record. This is based on the American Academy of Pediatrics. Like I said, your student information, your health emergency contacts, those will come right over from your roster. The parent also has the ability to go in and provide information like allergies. We have a list of allergies. Okay, I'm going to just pause. Chris, are you guys I'm getting some people saying that my mic is a little too loud. Some saying it's a little too soft. In general, can you hear me okay?
You know what, Melanie, it sounds like you might just be just a touch far away, so it might help to just get a little bit closer to the mic.
Okay, how does that sound? Is that a little bit better?
That's a little bit better, yep.
Okay, and is my screen blurry or is it clear enough?
The screen looks pretty clear to me.
Okay, all right. So thank you for helping me out there. I definitely want to make the most of everybody's time. So when your parents add allergies, they have the ability to provide information like the severity of the reaction, whether or not an EpiPen is required. Of course, they can add as many allergies as unfortunately they may need to. There's also questions in here like, has a doctor ever denied or restricted your participation in sports for any reason? If anywhere throughout this vital health record a parent says yes, they have to tell you why. They cannot submit this section, let alone the entire vital health record as being complete. If it doesn't apply, then they simply click no and they move on. As you can see, that there's a lot of questions here regarding to medical, bone and joint, heart health, which has been on the forefront of the news these days, with some children having issues on athletic fields. We do have the ability to have any of these questions be required, hidden, or optional. So again, during that implementation process, we have the ability to customize this to your needs. If there's questions that we're not asking and you'd like for us to ask, then we can create a custom section for you. We also have electronically signed documents, and electronically signed documents essentially for any forms that the school requires that only need a parent's signature, you can use an electronically signed document. You can do it for consent to treat, you can do it for a field trip form. I'm going to give you an example of permissions for over-the-counter medications. So again, during the implementation phase, we work with you to understand what OTCs your school offers. The parent can select yes to all or no to all, or have, go back and forth in between. Then they would just read a short consent, and they come in and they type in their name. And what we do is we do all of the verification on our end because we are HIPAA and FERPA compliant, which means that in addition to taking a date and time stamp, we also take an IP address stamp. So if it's ever called into question the validity of the document, we're going to have you all covered with our audit log. Again, you can use these electronically signed documents. You see several things here that are listed that are not necessarily health related. The way we look at it, if you want to purchase our software and there's forms that your school wants to collect that are not health related, by all means, please make the process as easy and as simple for your parents as possible. We also have the ability to collect text box. So if you want to collect athletic jerseys and sizes or those class t-shirts, you can do that. You can have yes/no questions, such as, can your child's picture be used on the website? Will your child be attending the spring dance? Yes or no? At the end of the day, somebody is responsible for keeping up with those tidbits of information, and this Magnus is a great way to collect that. Obviously, you're going to be collecting immunization records, but when it comes to the health of your students, what we normally do is ask conditional questions, which means that, does your child take prescription medications that the school is going to need to administer? Does your child have allergies? Does your child have asthma? If a parent clicks no, then they're simply going to click no and move on. If they click yes, then they're going to be directed to that particular form or an action plan. And I'll show you how that works with our physical form. So here, say that we need to download the form. Again, this would be your school's form. The parent's going to print it out. They're going to make an appointment with the physician, take it to the physician, and have the physical completed. When they're ready to submit it, they have two choices. The vast majority of our parents, probably 95% of them, will take a picture with their smartphone or their tablet, email it to themselves, and upload it from their computer, or maybe use a printer scanner. If that doesn't work and you want to fax it in, by all means, you can download our fax cover sheet. And our fax is actually a digital fax. And what that means is this barcode at the top. There's going to be an actual fax cover page for any and every requirement. So this barcode automatically knows that this form is not only for Maggie Medlin, but it's her physical form versus, say, an action plan. So I've talked through some of the various ways that you can collect information through Magnus, the vital health record, which is an extensive health history, electronically signed documents, text answers, yes, no, and then of course anything that requires a physician's signature and or fillable fields. You would use you download the form and then submit it back into Magnus. Before I leave this page, what I would like to do is I'd like to mention this due date up here. Obviously, a lot of schools will utilize Magnus during their enrollment and re-enrollment process. If you choose to move forward with Magnus, one of the things that we're going to want is the date at which you want each of these forms back from the parents. And then what we will do is we will, say if it's 8 weeks in advance or 4 weeks in advance, we will send out an email welcoming your parents to Magnus. And then we're going to send gentle email reminders each week until the parents have submitted their forms. So what that means to you all in the schools is there's no more need to pick up the phone and call the parents and try and track down them via the phone or email to get your forms submitted back in time. Those emails are going to look like they're coming from the school. They're just going to have a Magnus domain. And the goal here is obviously to have everything completed on time. Normally, what we see first year turnaround, you're going to have between 85 and 95% compliance. Year 2, you're going upwards of like between 95 and 100%. So we do see a lot of parents really loving this, simply because it's just an easy way for them to submit all of their different information. I will mention that what you're seeing here might be the things that are required towards, as you're starting the next school year, but you do have the ability to add different forms and requirements throughout the year. So say, for example, you've got a field trip and, a senior field trip to Japan that's going to be happening in the spring. You are obviously going to have a very specific permission form just for that. You don't necessarily want to ask for permission for that field trip in February and March of the prior year. So you do have the ability to go and add requirements as needed. So with that, I'm going to log out of the parent side, and I'm going to come back in on the nurse's side. What you're going to see is we have 8 main features here. We are constantly, like I mentioned, constantly updating and developing our software. So these will expand through the years, and there's lots of things that are being updated within each of these different features. Sort of pretending it's the beginning of the school year, we're coming to the student health tracker. And there's multiple ways to search for various information here. But what I'm going to do is I'm going to come down to this tracker summary. Anything that needs to be reviewed is going to be highlighted in yellow. So, and we have the ability through being able to get extremely granular on who has access to different forms is by setting up the user preferences. We can determine and we can make sure that the physical forms go to the athletic department and the health forms go to the nurse, enrollment forms go to admissions, etc. But here's an example of a form that I took a picture of with my smartphone and uploaded. And you can read down through the form. And you've got a couple of different options here. If it's something that the school only requires once, you can mark it complete. If it's something like a physical that is required on an annual basis, you can set an action date. And by doing that we will proactively email your parents 30 to 60 days in advance to tell us of that next action date, letting them know that it's time for them to set up an appointment with a physician to get a new form submitted. Conversely, if there's a need to reject, they have a common list of reasons. For those of you in the health industry or the nurses on the phone, obviously the fact that the physicians are getting to sign it is normally one of the most popular reasons to reject a form. One of my favorite things about Magnus is when you go to click next to review the next form, we are automatically going to email that parent letting them know that their form's been rejected and they need to submit a new one. So that is the form review. I should also mention that that for any electronically signed documents, we have the ability to set those to auto-approve because either the document has been signed or not. So what that means is that you can just go ahead and the school would not have to go through and review any of those forms that are electronically signed documents, which is the time saver as well. Really quick, when it comes to just ad hoc reports, you have the ability to run reports on any type of information that you're collecting from the parents. If you want to see immunization records and who's incomplete, any next action dates that are coming up in the next 60 days, you can do that. Also have the ability to run reports by trackers and groups. So I'm going to use an example of a field trip. So you've got a field trip that is coming up in 2 weeks and you want to see who all is not compliant. Well, here's your list of 7 students. And with any report that you run within Magnus, with one click, you can send an individual email to each of these parents. You can customize the message, letting them know that if they want their child to participate in the field trip, then they need to get the form submitted ASAP. Also, you have the ability to download that report, send it over to the chaperone, and just say, hey, I know we're a couple of weeks out, but from a liability perspective, just wanted to let you know we're still waiting on these 7 students. You can do the same thing for athletics, etc. So it's a great way to have these types of numbers at your fingertips within just a click or two. We received a lot of feedback from our existing clients that they wanted to be able to run reports, but also to be able to run those reports on multiple levels of data. So we created sort lists. An example of that is you want to run a report that's for the after-school children who are in the 1st and 2nd grades that have any type of action plan. And there's your students. So that way you can give access to whoever is managing, that particular group of 1st and 2nd graders for after school, make sure that they are aware of which action plans are on file. What's great about this is obviously we will train you all how to create these reports, but the wonderful thing is that you get to sort of create it and forget about it, which is nice. So you can always come in and view these whenever you need to. If you want, again, field trip, major health issues, not compliant, if you want to see who all on the freshman field trip has an allergy action that's incomplete, I mean, the sky is pretty much the limit on this. This has been extremely well received from our clients and clients. It's a great way to know that you have the ability to run compliance reports at any given time on multiple levels of data. What I'm going to do now is I'm going to move over to prescriptions. For those of you all who are administering prescription medications throughout the day, we do have a medication schedule that you can run for different times. I'm just going to say all times here. And here you can see, say Maggie comes in at lunch for her Adderall. And you can click here to show details. We just recently added pill quantity last week to Magnus, so we need to go in and update that, but that's going to be a great way for you to automatically know how many pills you have left. Say if Maggie is running low on her Adderall, you can quickly come in here in the additional comment section, type in a quick note that says, hey Mom, when you bring Maggie to school on Monday, please bring along a new prescription. And with one click, you can just say, hey, I want to share that with the parents and send an email. And we will send an email that will just say there's been a medication administration for Maggie. Please log into her account to see the details of that. What's also nice here is that for those of you who maybe wear various hats or are relieving someone who normally handles prescription medications, you can see right here that prescription medication has been received. As we all know, sometimes the small little kiddos sometimes forget that they've already had their medication. So this is a great way to make sure that you're not double dosing. Now I'm going to go into immunizations, which I know is a really big topic for those of you in California as well as across the rest of the country. What I'm going to do is I'm going to show you how you can actually view an immunization record. And then we'll talk about some of the reports that you can do. So again, anything that needs to be reviewed is highlighted in yellow. You can see that we don't delete things. So here's the form that the parents submitted last year. Here's the form that they submitted this year. And here you can clearly see on the screen the dates that have been filled out by the physician, as well as the physician's signature, etc. So with here, you've got a couple of different things that you can do depending on the demographic of your school, if you're pre-K, early childhood education, through 8th, or maybe you're K through 12, etc. For those young kiddos, you obviously would want to come in and fill out and mark in the dates for those kids. But say, for example, you've got, a 7th or 8th grader joining your school, or they've gotten to the point where, they don't require any more vaccinations, except for maybe one Tdap. Then what you can do is you can say, all right, for this child, they've received all of their vaccinations, with the exception of that last Tdap. And you can come in and you can set the date for that, and you're good to go. That way you can run a report and say, okay, who all has the next dose date within, the next 30 or 60 days. You also have the ability, if your school accepts children that may have tighter waivers or medical or religious exemptions, to notate whether or not there is a particular exemption for one or maybe all of the vaccinations. And that really comes into play back on the reporting screen. So say, for example, if you wanted to see, there's a potential outbreak of varicella, and you wanted to see who all had a waiver in place, you could run a report for that. So it's really easy to get your hands on that type of information. It's also nice to be able to run your non-compliance reports. So say you want to see who all hasn't submitted, we'll say, I don't know, a month from school starting, and you want to see who hasn't submitted their immunization record. You can run that report, and here is your 22 students. So again, you can send a mass email out to those parents and say, hey parents, first day of school is coming up in 4 weeks. We need to get your immunization record submitted ASAP. Then say you run that report 2 weeks later, and your 22 students is whittled down to like 8. With that, you're like, okay, I've been hounding these parents. What am I going to do? You can create a quick report, send it over to someone in administration who has maybe a little bit of a heavier hand, and ask for their support and their help to reach out to these parents and make sure that they're compliant and that you have their immunization records for the first day of school. So I will mention here that you have the ability to print all of your immunization records right from Magnus. So essentially anything that's uploaded into Magnus from a parent, like an immunization record, a physical, etc., you can print all of that information right from Magnus. So if you have an auditor that does show up on your doorstep for immunization and they want to see papers, then you obviously can be prepared and do that. Next, I'm just going to quickly mention that we have a check-in. So this is where you can have a kiosk in the nurse's office or maybe the athletic trainer's office for pre- and post-game therapy. All this requires is a kiosk, like a tablet or a laptop, and the student would just come in, they type in their reason for their visit, and, they type in their name and select a reason for their visit. What this does, this allows the nurse, as well as trainers, etc., to go in and triage. Obviously, they're going to see the student that is bleeding before the student that has a rash. So a lot of, for those health offices that get really busy in and around lunchtime, schools that are seeing 30, 40 kids a day, athletics, robust athletic programs, this is a huge time saver for those departments. So let's just say that a student comes in to the office and is complaining of, we'll say, a headache. This, you can go in and you can actually pull up the student medical record. So here you can see Brody, you can see the groups that he's associated with, any allergies, anything that's life-threatening or debilitating is always going to be highlighted in this pinkish red, so you know that you're dealing with a sensitive student. I'll come back to clinic alerts in just a second. Emergency contacts right up front as well. And you also have the ability to pop in and see any OTCs that the student has been given permission for, as well as any prescriptions. You can see we keep a running list of the last 3 treatment notes, and I'll come back to that in a second. And then these are folders, and this is really neat. So this is essentially your digital filing cabinet. So for all of those records that you're legally required to hold on to for 7 to 10 years after the student has left school, we, during implementation, can create as many folders as you'd like, name them whatever you'd like. And this is where you can store those return to school, return to play, impact testing, etc. When it comes to a treatment note, so say that Bertie came in for a headache, and you can type in the assessment, type in the treatment given, what the disposition or out, did they return to class or did mom pick them up? What was their general appearance? Do they have any major pain? were there any signs and symptoms that are associated with it, as well as any medication, etc. I will tell you that we do have the ability to customize these notes. If this looks rather extensive, then that's fine. We do have other options. For example, something like this. That's a little bit less robust. We can definitely handle that as well. And again, you know, we have the ability, you have the ability on a per visit basis to determine whether or not you want to share that treatment note with a parent or not. You see the share with the parents note email, so that's for your helicopter parents that you know are going to be logging into Magnus every day. So that way, you know that they're logging in, and there's no need to necessarily fill their basket, their inbox, if you will, with a bunch of emails. Also, I just want to point out that your athletics trainers can have soap notes in Magnus. The vast majority of schools will use this for incident reports. So whatever your protocol is for incidents, you know, we can customize this so it looks exactly like what you're doing today. And a lot of counselors will use this because we have the ability to limit access to counselor notes to only the counselor and maybe the head of school. A lot of schools will use 504 plans, student tracking. So there's multiple ways to utilize Magnus in our treatment notes outside of just health-related information. Chris, you know what? I totally did not give you a chance to talk during immunizations. Do you want to back up and we can go to that real quick?
Absolutely, yeah, thanks. And thus far, I will say, every time I go through a webinar like this with you, or I sit in on a training that you do, I remember why I love Magnus so much. So thanks for that.
Great.
I'll say, taking a step back to the immunization piece, and obviously, as of now, this is specific to our California schools that are on with us today. But we are getting ready for the first major modification to the immunization program as a requirement in quite a few years in the state of California. And so most of you, if not all of you, should have heard that as of January 1, there is a very different process in place for that PBE, or personal belief exemption, that Melanie talked about earlier. And during the setup process, I imagine that you'll be able to modify what types of PBEs are in place. So Magnus will be able to help you be compliant in as much as you know, medical exemptions will be the only ones offered moving forward. That being said, we use Magnus at a number of our schools that we have health aides at, as well as even some of our schools where we just consult on a regular basis to create our immunization reports. And for most of you, you should know that at the beginning of the year, you're required to report on certain grades. And kindergarten is always one that's reported. 7th grade tends to be reported in most states. And anybody who has an ECC or a preschool on campus probably has reported at least once a year, if not perhaps once every other year, depending on what state you're in. But regardless, the ability to run a report out of Magnus and say X number of students have an exemption, and again in California that's only the medical exemption. If you're out of California, it may be any of those exemptions or even some others. And be able to just take that data and pull it right off of Magnus and drop it right onto your spreadsheet, whichever it is that you're submitting, is so incredibly impactful from a time perspective. For years, we used to do it with spreadsheets and tally marks and Post-its and stress. And now, over the course of the last several years, we've begun to use the immunization exporter and can now literally just generate the report exactly how most states want to see it and transfer that information right over to their documents. And so it's one of those things that perhaps you don't either do the reporting yourself or do the data transfer yourself, and as a result understand how much stress and pain is caused by that. But if you do, I trust you recognize that time of year, September, as perhaps one of the most difficult in the health office or frankly on campus, for not only the dozens of reasons that go along with just the start of the school year, but the immunization reporting process. And so I just always like to take a moment to remind everybody or share with everybody how much easier that can be by using a tool like this. And so Melanie, I'll let you take it away.
Yep. No, thanks, Chris. That's huge. And you're exactly right. Unless you're in the weeds in immunizations, it can be very, very difficult. When the MMR outbreak happened last year, our phone started ringing off the hook, which is good for us, but sad for the schools, right? Because there's just so much liability that's put on your shoulders. So you're absolutely right. And with the new laws in place in California, Magnus can definitely help out to help you be prepared. I will mention that we are seeing a lot of schools that are going to what we refer to as a zero tolerance policy, and essentially not allowing any student into schools, and this is across the country, unless all of their medical information, especially their immunization form, has been submitted. So they're not allowing students to start school until they have that. That's helping a little bit with some of the stress, but just to pass that along as sort of some best practice. I've just got a couple of things to show you. We do have treatment notes, so here's where you can come in and keep track of all the different types of notes that you're doing. I'm not going to spend any time on this. Just know that for every treatment note that you do, be it an athletic injury, be it a screening, be it whatever, you can run reports on who actually did the charting, how many you've had in the past week, how many you've had in the past month, list values, etc. What I do want to spend my last few seconds on is clinic alerts and Magnus. So we created clinic alerts in response to schools saying that they wanted to have the ability to have a watch list and also to be able to improve communication throughout the school. I am going to just sort of use Shannon as an example here. A great example is to say that you've got a child that's participating in basketball. They had a game last night. Shannon goes up for a rebound and takes a knock to the head. And you can see here, I can say I'm the trainer who's made that note, right? I can get the team in there. And what's nice is, you say the knock to the head, but there was no signs of a concussion. And what that trainer has the ability to do is to save and send an email. And when you click save and send an email, you have the ability to select all the different users at the school that you would like to share that information with. So essentially what that means is if you've got that Shannon walks into the nurse's office the next day and complains of flu-like symptoms, the nurse can say, hey, I got an email from the trainer last night when he made a clinic alert. So Shannon took a knock to the head. I could very easily be dealing with a concussion, a late onset concussion versus the flu. So it's just a great way to, again, improve communication throughout the school. You can use it, as you can see here, for a multitude of things. We've got schools are absolutely loving this. It's a nice way to keep up with things. Lastly is let's talk about, we feel like we prepared everybody to handle any type of incident on school. Let's talk about being prepared to move off campus. So here we have the ability to print 911 cards or emergency cards. You can do this by the grade year or you could do it by the group. And you can select different amounts of information depending on if it's a half-day trip to a museum versus a week-long trip to Peru, for example. You come in, you select the information that you want to have on the form, and this is what it creates. There we go. And let me expand this. There. And so this is so it creates essentially one page for each student. And it's got all of the relevant information. EpiPens are highlighted in red. It's got pretty much everything that you would need to get started at, say, an urgent care. Now, we will tell you from best practices, we recommend that every school print off a 911 card and a consent to treat at the beginning of the year and after the winter break in case there's been any updates, and put those into your earthquake or your hurricane shelters. Just so that way you've got it on paper. I will say that if you're going out into an area that there is no cell service or no internet access, because we are web-based, you have the ability to run these reports. You can download this report onto an encrypted thumb drive and take that information straight with you. So if you know you're going into an area where, like I said, you're not going to have the ability to have robust communication, you just put it on an encrypted thumb drive, and you can pull up that student's information and have access to all of it. If there is, Chris, did you want to interject here at all, or should I go ahead and show the the rest of the Magnus 911?
Thanks, Melanie. You know what? I'll let you keep going. I do have. It looks like there are a couple of questions I'd love to answer. The first one is from Bob, and Bob was wondering how are we doing, or how's Magnus doing on being able to print the California immunization form? And
so the actual blue card.
It looks like, yeah, and I'll let you take a first pass, and then I also have a strategy that we use for our schools that we conduct those forms for, so I can shed a little bit of light on some workarounds as well.
Okay, great. So right now we do not have the ability to get it into the exact format. That is something that is high on our development roadmap, Bob. We're just not there yet. I do expect to have the ability to do that within the next calendar year.
Awesome. And I like to share that in terms of creating the report that comes out of basically consolidating all of those blue cards and then reporting into the state exactly how many students are immunized, how many are conditional applicants versus accepted students, and things like that. What we typically do is we'll build an immunization report that details the specific number of students that have exemptions. And up until this year, we used to separate those out. Obviously, next year we no longer will need to do that because there will only be one exemption. And then we just take that data and transfer it over to the form. So although we can't physically print right onto it, it's very, very easy to pull the data, go, all right, that's 8 students, drop that over here. All right, that's 46 students, drop that over there, and submit that form. And for the most part, we either do that online on safeschool.org, or rather shotsforschool.org, or on the paper form from the same site. So great question, Bob. And Melanie, I'll turn it back over to you.
Okay, great. So like I mentioned, this is oftentimes enough information to really get started at a, at an urgent care or something like that. And again, if your school does print forms and wants to take those to, print them off and take them with them on a trip, you can definitely do that. We just recommend not printing as much as you have to, and having those papers leave campus, because sometimes, unfortunately, they don't come back. That's why downloading onto a thumb drive is a good alternative. But let's say that there's a situation where there's an actual true emergency. Every student is issued a 911 number. And so when the paramedics arrive on site, they're going to type in this 911 number and the 16-digit number, and this is what they're going to see, which is essentially every single document that you at the school have deemed an emergency document. They can click in, they can see all that information, and they're going to have everything from the vital health record that the parent submitted. So what this does is this truly allows those paramedics to treat your student as a patient versus guessing, which, is a powerful, powerful tool. I will tell you that we do have a free mobile app for Android and iPhone users, and the user access at the school, we have an unlimited amount of users that you can have at the school, so whatever their username and password on their laptop is going to be the same on their phone. And they come in and they start typing in the last bit of, or the first bit of the last name. They're only going to have access to particular students that they can see. They can see any groups that the student's associated with. They can see any clinic alerts, has been complaining of headaches after football practice. Of course, any allergies, anything life-threatening, since the student highlighted in this pinkish red, health emergency contacts are going to be touch to call, touch to email. And of course, you can see all the various sections down here. You also have 911 documents right here. So everything, all the emergency documents would be listed. So you'd be able to just pull up your phone on your app, say you're at a soccer tournament and there's being monitored by paramedics and a student goes down, the EMTs run over. Here you can immediately show them the 911 documents. And then, of course, you can perform Magnus 911 right from your phone. And if it's a situation that's not life-threatening, but the student's going to be going to a medical facility, you can click Send Fax, type in their fax number, and we'll send over all of the emergency documents as well as the vital health records, so that way the provider is prepared to treat that student. So that's pretty much all I got at Chris. We got some additional questions.
Awesome. Thanks, Melanie. And it looks like there are a couple other questions, and I'll just add to the end of the tail end of that Magnus 911 piece that's one of those features. And I think I shared with you earlier that my favorite feature of Magnus is the immunization piece. Well, the other favorite, and yes, I of course only have one favorite, is the Magnus 911 tool. And it's just it's so easy to use, and it provides so much access to EMTs, paramedics, and then the receiving hospital in terms of what's going on and painting a full picture of that student. My background prior to having started Joffe was as an EMT and a paramedic, and more often than not, we would show up at schools and they would have a little bit of information for us and perhaps an emergency card. Obviously, this was quite some time ago, so online systems weren't quite as big back then. But the schools would give us this sort of piecemeal part of a story, and then we would translate that, and of course, like the game of telephone goes, we would translate a piece of that to the hospital, and ultimately the student would receive about 30% of the care that they could have. Now with the tools available, we can give literally a full picture of what this student looks like from a history perspective, from a medication perspective, and from an allergy perspective, and obviously so much more. But that information, and again, for those of you that aren't directly from the health office but are from the admin side or from anywhere else on campus, that information can be so impactful in terms of treatment. Just a couple of weeks ago, we had a student who was sent from one school to a hospital, and I won't tell you what school or which hospital, or frankly even what state, but the student was sent, and based on the treatment, or rather based on the signs and symptoms that the student was displaying, they would have received a medication that they were allergic to. And this was a little boy who, had he received that medication, would have had an allergic reaction, and obviously, even had it not been a life-threatening allergic reaction, although in this case it likely would have been, it was something that was avoidable. And sure enough, with the Magnus 911 tool, it was avoided. And so this happened just a couple of weeks ago, and it's been one of those things that just sits in the back of my mind and reminds me of why tools like this exist and how important they are. Of course, those of you from the health office have probably very similar stories based on the amount of information that you've been able to provide. But again, for those of you that aren't necessarily directly from the health office, that's just one of dozens of examples of how a tool like Magnus 911 literally can save a life. That being said, it looks like we've got a couple other questions. The first one is, when's the best time to launch Magnus? And this one came from Jerry.
Hey, Jerry. So I'm getting an echo. Most schools will launch Magnus before enrollment and re-enrollment, so that way they can have all of their forms be collected. They're only asking the parents once for information. That is the preferred method. However, schools sometimes will come on board, and if they're used to collecting their forms in the summer and they want to continue to do that, then we obviously like to get started on implementation maybe around April before they leave, and we don't like for them to leave school without having implementation completed. So it's either during re-enrollment or in late spring.
Awesome, thank you. And it looks like the next one was, can you tell us a little bit more about the action plans?
Sure. Yes. So if your school doesn't have any action plans, we do have obviously a huge reference library full of action plans. So if that's something that you need, we can definitely provide it. And again, we've just found over the years through best practices is if you ask those conditional questions, that way you're only collecting information that's pertinent to hopefully a very, very small percentage of your student population. And by having those action plans on file, accessible for teachers, coaches, etc., to see, we've seen several, as Chris mentioned, life-saving situations because those action plans are on file and available. Good question.
Awesome. And it looks like that does it for the questions. So thank you so much, Melanie, and I'll get ready and share just a little bit more information with everyone that's with us today. We are excited to have had the opportunity to share this information with you, and of course want to make sure that we continue to answer questions for you and ensure that we give you as much information as possible. And so we will send a quick follow-up out later on, I'll say later on this week to be sure, that will have access to Melanie and give you some contact information for her, so that if you have other questions for her, that you can share those. You will also be sent a survey, so that that'll give you an opportunity to share with us what you thought of our new technology, what you thought of the content today, and then also share with us any concerns or topics that you'd like us to cover in the future. We're just looking at the rest of the year, and our series, as soon as we get back from winter break, will consist of basically a mini-series talking all about the emergency preparedness teams, and so looking at the first aid team and search and rescue team and command center, and specifically what each of those teams are supposed to do. And that series will be about an 8-week-long series. Beyond that, we'll have a little bit more information about concussions and sports injuries. We'll have a number of different scenarios and case studies that we'll share with you as we head into the end of the year. And then we'll have some challenges that we'll share with you, and those will be opportunities for some of you to actually jump up in the driver's seat and say, this is how I'd manage this emergency, or this is how I'd manage that crisis. And so as we go on through the rest of the year, we cannot wait to share those with you. I'll share with you that today, as a result of your participation, we would like to offer you the ability to get an assessment and an independent perspective of what your school safety program looks like. And so in just a moment, we'll share this with you on your screen. But our assessments typically are about a 90-minute conversation where we walk through the challenges that may be occurring on campus. We walk through the safety program that's in place as of the moment, and we go through a number of different criteria. And again, we're evaluating on the health office and systems that are used within, as well as the overall preparedness program, looking at the response teams and even response training, so CPR and first aid training and things of the like. Whether or not there's a business continuity plan in place, so in the event that we needed to move school because of a fire, earthquake, or lockdown, could we do that? And is it manageable? And are there clear and concrete steps in place? And so we look at those things, and again, just so much more. If you're interested in that, you'll be able to click the link on the right-hand side of your page, and it looks like it just came up, so you can just click that sign up button, and we can get in touch with you to schedule that. We are looking at trying to get, I think, just 2 more in before the winter break, so we're pretty slammed for next week, but we'll try to take at least 2 out of today's conversation, if at all possible. And worst case scenario, we'll get you on after the break. That being said, a great big thank you to each of you for being with us. Thank you to Melanie and to Magnus Health for being with us today. We can't wait to see everybody in the new year, and in fact, I realize now I'm jumping one step ahead. We do actually have a webinar next week before break. I'm ready, I guess. But next week's webinar will be on business continuity, and so specifically talking about that continuity process and how we pick up and move school if we need to. So I won't say have a great break quite yet, but I would like to say thank you so much to everybody for being with us, and again, thank you, Melanie, for being with us and presenting today.
Thank you so much, Chris. We really appreciate it.
All right. Everybody have a great weekend and have a great last week before break. And if you're like me, obviously you're ready for it. So enjoy it as much as you can. We'll talk to you next week on Thursday. Thank you.